Good morning, everyone. This is Yolanda Curry from the Chicago Department of Family and Support Services, beginning the webinar regarding our Health Promotion Services, RFP. First, we'd like to thank you for your interest and look forward to maybe you considering actually filing an application. First, we'll just start with an overview of our department. We have, if you will, a refreshed mission statement for the department, and that is, I'll just read it verbatim for you. We're working with community partners. We connect Chicago residents and families to resources that build stability, support their well-being, and empower them to thrive. So we definitely feel like our health promotion program really is kind of centered to the support the well-being and empowering people to thrive. Just some general information about the request for proposal. It is actually due back September 12th, 2007 at noon. So it's not end of the day, it is a hard close at noon. So just pay attention to that. This is a 3-year award and it'll commence October 1st. So like in another couple of months, we're looking to be operational. And this award comes with the possibility of 2 1-year extensions. In terms of funding for the program, this initiative is funded from the Older American Act, and we're using Title IIIB, multi-purpose senior center funds, as well as health promotion funds with a little bit of CDBG. We feel like this blend of funding is really great because it allows us the capability to, in addition to the health promotion curriculums that we can fund through the Federal Older American Act, we can also have some of the other kind of practical assistance with the health professionals on the ground, which seems to be very popular at our centers. What we have available in funding citywide is $300,132. And the unit rate for all program services related to this RFP is $45 an hour. In addition to the services that are provided directly at our senior centers, there is an opportunity as well to have someone, a registered dietitian, review citywide menus for our senior nutrition program, which consists of a congregate dining program and home delivered meals. So the purpose of our RFP really is to provide or to find health promotion providers, if you will, for our 21 senior center locations. So we have 21 senior centers located across the city of Chicago, and we're looking for people to come on site to provide practical assistance in the way of supplying a health promotion team that will comprise a registered nurse, a licensed clinical social worker, a registered dietitian, and a pharmacist. And the use where it comes to Title IIID dollars of those top-tier evidence-based curriculums. And we'll get into that a little bit later in the PowerPoint. And also, as we just referenced, it's the review of nutrition programs and any other kind of related consultation for our nutrition program. Okay. So just in general, I guess to give context to who we are the senior service section of the Department of Family and Support Services, but we also serve as the local area agency on aging for the city of Chicago. And related to that vein, we offer a whole continuum of services for older adults, generally speaking 60 years of age or older, but through the community development block grant funds that we have, we can leverage program opportunities for baby boomers that we like to call those 55 years of age or older. We've had a long history at our senior centers in providing health promotion activities, and it is one of the core programming elements that are provided. And again, I think we talked a little bit about like the age category, but generally speaking at our satellite centers, in terms of eligibility, it's 55 years of age or older, and at our regional centers, it's 60 years of age or older. And so who's eligible to apply for it? It just looks about like everybody knows, but it's nonprofits, for-profit, faith-based entities, public and private. And the other thing is we are open to, if you will, like agencies partnering up and subcontracting if that works best. Again, the city is very diverse. We have 21 site locations, and there are like diversity in neighborhoods. And so however you want to try to maybe capitalize on that, we're open to discussing. So again, in terms of who we're looking for to do this work, we're looking for a health promotion team. Again, this is a core part of our programming calendar, and we're really looking for the services of a registered nurse, a geriatric social worker, a licensed clinical social worker, a registered dietitian, and pharmacist. And so when you're building this proposal, we just need to assure that the team that you're putting together, one has the experience to hit the ground running, to be able to provide all of these different service components, and then it's adequate to meet the needs of all 21 senior centers or the number of senior centers that you're actually proposing for. So when you get to the application component of this, you can select if there are like certain centers that maybe you're interested in providing services to, as well as maybe looking to do it citywide. And in addition to that, in terms of the evidence-based curriculums, again, there are like, you know, a lot of different ones that have different master training requirements, and however that's going to be, and having the licenses and all those kind of back offices responsibilities associated with that, we're going to want to make sure that that's true. We're going to want to make sure that you're credentialed and you're signed up, you know, with the leaders of those curriculums. So in terms of the program design and what we're looking for you to do, we're looking for you guys to offer monthly health presentations or workshops at our centers. That should happen basically 2 to 4 hours a month at each site as demand dictates. And then in addition to like the monthly presentations, we're looking for some one-on-one consults so that the participants at the centers can kind of go in and utilize services, and where appropriate, we're looking for health screenings and referrals. So again, I think where we're kind of talking about program designs and scope of service and things that we're looking for, again, because we have a wide array of adults who kind of come through our doors and, you know, are unique. We're also looking to gain from your expertise. So there may be opportunities or situations where we're going to want to consult with you to talk about the needs of maybe an older adult who we see exhibiting certain changes in behaviors or functioning, and just lending that expertise to try to, you know, help them to, again, age gracefully in the community. In addition, we have, if you will, semi-annual, monthly, quarterly meetings, and you may need to meet one-on-one with the center director or as a greater health promotion group, again, to advance our programs and services and resolve any problems. The other thing is this is a core programming function for our centers, and so we need to make sure that you have a backup plan in place to make sure that we have services. So you need to think about like what that substitution situation may look like. In addition, we kind of talked about the diversity of the city. So there may be certain centers where you want to assure that we are able to service people from different populations. And as well, there's links later that'll talk about what some of the approved curriculums are, and we want you again to provide that as part of like the programming piece. And so again, here what we have listed really is the places where you can find more information about some of those approved, if you will, curriculums. Some of the ones that we've implemented on the ground currently is a Matter of Balance, which is a fall prevention program, Walk with Ease, which is a walking club type situation, or Tai Chi for arthritis. We do in our fitness program, we may not necessarily under this initiative do Fit and Strong, but that is something that's being implemented at our senior centers, as well as another nutrition-related curriculum, and as well as the Stanford University Chronic Disease Self-Management Series. So again, you can kind of look at those things, and we understand that this is a tight budget. So when you're thinking about that, and when you're thinking about like the price that are associated with it and what training costs, that's why we're allowing you some flexibility and to propose back to us what you would be interested in providing. In terms of performance goals, as part of like the department's overall kind of mission and where we're going as a unit, is we're really trying to move forward to more outcome-based measures. So in looking at the RFP, there are like maybe, I don't know, 1, 2, 3, 4, 5 things that we're really going to want to look at. And one is our ability to leverage people actually enrolling in some of these evidence-based programs. So we're going to track the number of participants who are actually enrolled, and of those who are enrolled, how many people are attending based upon those frequencies. So for example, if chronic disease self-management is a 6-week series program, we really want to see like how many people are actual completers. Completers could be those who attend 4 or more of the 6 sessions, and we really want to see, you know, based upon those fidelity, if we're actually getting people through the curriculums and they are attending in such a way so that we can get those performance outcomes that are associated with those programs. And then the other part in terms of like really looking at quality, I think is going to be more of like a self-report from the participants themselves who say or report that they feel better or they're better able to manage their health from participating in the program. And the other one is if they also feel like that they're maintaining or improving their overall health. As it relates to the menu review, we're just going to look at a simple measure of how many days that it actually takes to complete the review of the menu. So those are the performance goals as outlined right now for the program. I think year one, we're just trying to get like some baseline information, and then we can kind of move into goals and how we kind of move the goal forward. So in terms of the actual evaluation of your proposal, each proposal will be evaluated based upon the strength and the responsiveness to the selection criteria. And again, you should be able to be operational October 1 of this year. And so failure to submit a complete proposal or fully respond may deem your proposal being unresponsive and therefore subject to rejection. So please look at the proposals very carefully and answer each question very completely. So in terms of the selection criteria, they fall, it looks into 1, 2, 3, 4 areas. And one is your previous experience providing health promotion services, the actual program design and administration of the program, your administrative or fiscal capacity, and then 15 points for the budget. I think the next slide we'll talk about, we're not really looking for you to, or it'll be after that, the actual budget itself, but that you will accept a $45 unit rate, and that is really not negotiable at this point. In terms of where the application is, there's a link here, and again, we're reiterating that the RFP is due back September 12th at noon. And so just some, I guess, technical information about the CyberGrant system. It operates best using Chrome. There's the login page, the email address. You create your password, and then there's a detailed need help section that we can respond to. And I think any of those technical questions we should send to Julia Talbot?
Yes, call me or email me if you're having problems logging in, and I can help you with that. As Yolanda mentioned, CyberGrant operates best in a Chrome browser or Firefox. It does not operate very well at all in Internet Explorer. So more or less just avoid using it in Internet Explorer for best results. You're able to save your work in the application. You can only access the application through that link. You can't log into an existing Cyber Grants, your existing Cyber Grants account and then access the application through the account. It doesn't work that way. You have to go through the link to the application itself and then log in, as opposed to doing it the other way. But other than that, if you're having problems, just give me a call or email me, and I always respond within, usually within the day. If you have something that's that's more technical than sort of just your basic logins, you can go to the Cyber Grant. There's a Cyber Grants email for more specific and technical support. They will respond within 24 hours, but that's going to take you a little bit longer time. So it's, as we're kind of stressing, it's important that you start your application as early as possible so that you can get any kinds of problems that you might be experiencing out of the way, or get your questions addressed in a timely manner, so that you can get your application in on time. Additionally, if you're having problems with uploads, with anything like that, just please email me and Yolanda to let us know what you're experiencing. We can usually figure out a workaround or solve most problems. We're very good at that, but we're not so good at doing it 30 minutes before the application is due. So I encourage everybody to do their applications early, so that if you're running into issues, that these things can be supported and resolved in a timely manner, and that you don't, that you have the opportunity to submit the most complete and the best application possible, as opposed to something else. That being said, if you do find yourself in that particular corner with very little time, when in doubt, always press submit, and submit, always, it is better in terms of the Cyber Grant system, in terms of our ability to do after-the-fact management on whatever is going on with your application. It is always better to submit an incomplete application into the Cyber Grant system than it is to not submit an application at all because your application was incomplete. So I would say if in the rare instance that you were running into some kind of issue, contact us, and if it comes down to it, always submit, even if you're submitting an incomplete application. That's it.
Okay, so in terms of the program budget, you do not have to submit a formal budget, as there is a pre-established unit rate for the program, which is $45 an hour, but you shall acknowledge the acceptance of this rate as part of our evaluation criteria for this proposal. Okay, so again, make sure your responses are complete and detailed as possible, and make sure that the requested documents are uploaded. A link to the completed webinar will be available online at our website for those who could not attend or would like to revisit this event. You will receive an email when it is available, and if you have any questions related to this RFP, you can email me at yolanda.curry@cityofchicago.org, and any of the administrative tech type questions, you can send those on to Julia. Thank you for your time and interest in serving the seniors in Chicago. Bye.
We can take questions at this time. If you have any questions, you can go ahead and just type them into the question box, or we can unmute your phone and you can speak directly to Yolanda. Let's go back to a different. And if you have questions, you can go ahead and type them in the chat box, or just raise your hand and I can go ahead and unmute you. You can ask your question live directly to Yolanda. How soon will the slides be available? I'm assuming the PowerPoint slides?
Mm-hmm.
Yeah, I did. Well,
That information will be available later today.
thank you. So if you have any more questions, we'll send the webinar info letter later today, along with a PowerPoint. But if there aren't any more questions, then we'll go ahead and sign off.
Thank you, everyone.
Thank you.